So I got a question about bone spurs and arthritis in the spine. First, let's talk about why they're there. When we have a disc damage, and in the spine you have bone, disc bone, that disc is basically soft tissue structure, and that's what gets damaged on people. And when that disc gets damaged, those bones actually shift and get stuck. So there's essentially a lack of motion at that joint. And when the body perceives there's no motion in any joint, whether it be the spine or your elbow or what have you, the body will systematically eliminate that joint over time. And the spine typically takes about 30 years to go from a nice thick disc down to bone on bone, and where those spurs are growing off and touching each other. And that process can be stopped because when there's motion at the joint, the body will say, hey, there's something there that we need to keep, and it'll stop that process. But if you're not under good chiropractic care, and good chiropractic care is the only thing that can stop that, you're just gonna continue on. And if you do have a degree of that, it's always gonna look like that on x-ray. So what I always tell my patients is I can't make it look any prettier. So if I x-ray you 10 years down the road, it's not gonna look any better, but if we do our job right, it won't look any worse. So the degenerative spurs are there simply because of no motion. And that's a lot of times what people are told is arthritis. But really arthritis, in my opinion, in what I tell people is arthritis, is true autoimmune conditions that are actively, aggressively attacking and destroying structures. And those are typically things like rheumatoid arthritis or psoriatic arthritis. But the osteoarthritis that a lot of people have in the spine or what have you, that's simply from a lack of motion, and that can be completely stopped, but it can't be reversed. But that's really not necessary. You know, a good majority of my patients, they have a lot of degeneration, and I'm very upfront that it's not gonna look any better, but we can get a lot of the function back, and obviously when that happens, they feel better, and without an x-ray, wouldn't even know they have it. So people shouldn't get hung up on how it looks. They should be concerned with how it functions and is there any nerve pressure. So the long story short is, yes, you can do a lot about it from a structural standpoint. Don't be concerned about it because it's not the spurs that cause problems typically, because spurs, most of the time on the x-ray are on the front and side. They're not growing into the little holes where the nerves come out of. And that's where it gets to be a problem. And that has to be very, very severe. Most of the time, the spurring is not severe enough to actually cause what we call enough stenosis to actually cause symptoms. So most of the symptoms are simply because there's no motion, the disc is swelling, and we definitely can handle that. So I hope that helps.